Physical Therapist.
And I'm Kelly Breedeville, Physical Therapist. We're here today at Canyon Physical Therapy and Aquatic Rehabilitation to introduce some new videos to the Elevate video series. These videos will include exercises that will focus on lumbar spine mobility, stability, and functional strength. The lumbar spine starts at the bottom of the rib cage and goes down to the pelvis and tailbone region. The muscles that support the lumbar spine include the abdominals, glutes, hips, upper and low back musculature. This musculature makes up what we call the core.
Today we want to begin with foundation movements for lumbar spine mobility. When we're in pain, we tend to avoid movement. These exercises will give you some options to increase mobility in a pain-free way for the low back, which increases blood flow, improves stretch and compression of the ligaments, cartilage, tendons, and the disc, which improves their health, decreases inflammation, and can decrease pain. While all of these movements should be pain-free, if you do have pain, try decreasing the intensity, and if you still have pain, you should wait and consult your physical therapist before continuing.
We'll be introducing 6 exercises that are going to focus primarily on lumbar spine mobility. These exercises can be done laying in your bed or on the floor. Usually a firmer surface is typically a little bit better. If you're having back pain, we suggest that it's best to perform the log roll technique to get down to the table. So we're going to have Libby demonstrate this. She's going to lay down onto her side, bringing her legs up, and then rolling back onto the table, keeping her legs bent. The first exercise that we're going to do is called the lower trunk rotation. This exercise is going to be performed in this position with her legs bent, knees together and feet flat on the table. Once she's in this position, she's going to gently start rocking her legs side to side, just staying within a comfortable range of motion. She shouldn't go into pain, and if she does, she should limit that motion a little bit further. This exercise is going to help to start to introduce gentle rotation to the lumbar spine, which helps to nourish the discs and also the cartilage of the facet joints. A gentle oscillatory motion in this position, where we just limit the motion even further, can actually help to inhibit pain or turn down the pain signal. You should do 10 to 15 repetitions in a comfortable range of motion. The next exercise I'm going to have Libby perform is called the single knee to chest stretch. With this exercise, she's going to start in the same position, back flat, knees bent, and feet flat on the table. She's going to take and grab behind her knee with both hands and gently pull her knee towards her chest. In this position, she can also hold in front of her knee if she would like, but if she does have knee pain, it would be advisable to hold behind the knee. Once she's stretching, she should feel a bit of a stretch in the glutes and in the lumbar spine. She's going to hold this for about 20 to 30 seconds and perform 3 to 5 repetitions. She's going to try to alternate left and right for that total of 3 to 5 repetitions on each side. If she wants to increase the intensity of the stretch, she's going to straighten the opposite leg out and then again pull the knee towards the chest for a little bit stronger stretch. The next exercise we'll start back with both knees bent, feet flat on the table. This stretch is called the Piriformis Stretch. She's going to take this ankle and place it here like she's crossing her legs. Then she's going to take and grab behind the knee and pull her knee towards her opposite shoulder until she feels a stretch in the back pocket area. This is going to help to start working on the flexibility of the deep hip rotators and piriformis muscle. Again, she's going to hold this stretch for about 20 to 30 seconds, and she's going to repeat 3 to 5 times on each leg, alternating back and forth.
Our next exercise we're going to do is an active hamstring stretch. To do this, we're going to use the help of a belt. With your knees bent, you're going to put that belt below the foot, and then you're going to actively straighten the leg using your quadricep muscle. Once you're at the top, you're going to use the belt to add a little overpressure for 2 to 3 seconds, and then relax down. The reason we're doing this with an active kick using the quadricep is that muscle activation in the quadricep can help inhibit muscle tone here in the hamstring, get a little bit more flexibility, and that guarding we can see as a result of lumbar spine pain. Our next exercise we're going to do is in side lying. To start, we're going to lay down on your side, have your shoulders stacked and your hips stacked. Knees are bent with that bottom leg out straight. All we do for this one is just start with a slight rotation back from the shoulder. Once you get moving, you can see what feels good. You want to rotate through your pain-free motion, 10 to 30 repetitions. The goal here is to increase rotation at the lumbar spine, which improves blood flow and can inhibit pain. So more repetitions is better with this one. If you want a progression of this exercise, what we can do is add a towel roll or a bolster under the waist. What this does is start you in a little bit of a stretch. So as you rotate, you're getting a little bit more range of motion. Our next exercise is in almost the same position. So I'm going to leave Kelly here and keep the towel roll underneath. However, you can always remove that if that's uncomfortable. We're also going to use the help of a bolster, which looks like this. If you don't have a bolster at home, a folded up pillow works just as well. Once that top knee is resting on the bolster, we're going to do that same rotation from the lower trunk, from your hip. So you're just rotating the hip forward and back while your shoulders stay relatively stable. Again, this is getting that rotation in the low back, just moving from the pelvis versus the upper trunk. You do 10 to 30 repetitions. As long as it's feeling good, we always want pain-free motion.
Libby and I hope that these lumbar spine mobility exercises help you to improve your function and elevate your health.